When interviewing the community, I interviewed Fatima G. She is a social worker who has worked with patients 65 and older for over 20 years. The learning needs in this population include awareness with adult daycare. Most don't go since they don't want to lose benefits from Medi-Cal, CalFresh. However, they do not lose benefits. Instead, they gain more services such as breakfast, lunch, transportation, and social activities such as bingo, loteria, arts and crafts, and the celebration of holidays. There's a need to learn how to use technology. Many times they don't have the ability to use their cell phone. With this inability, they cannot charge it, and if an emergency happens, they don't have the ability to call 911. Another learning need is that there's access to an emergency service by using a medical alert system. The only downfall is that there is a monthly price of about $20 to $45 a month. The health needs in this population include mental health. Depression is very common since they are lonely and may suffer insomnia. Many times, these people suffer neglect with kids due to work. Another health need is medication non-compliance. Many times these patients miss the time to take their medication, instead take two medications at once. These two side effects such as dizziness and feeling sick to the stomach. Another health need is drug addiction. They take this type of medication to get sleepy. However, in order to obtain the medications such as Valium, Xanax, and lorazepam, instead of getting the medication in the United States, they go out of the country and they pay out of pocket. Another health need is their diet. Many of them are poor and don't have access to better food due to cost and the culture. For example, Latin American culture tends to eat tortillas, and this leads to diabetes. Another health need is dental services. Many times, patients wait until they have an infection, which ends up costing more money and even ends up the loss of their teeth. The services available for this population are transportation. One example is access services. It is used for those who have disabilities, such as those who use a walker or a cane. Usually the cost one way is $2.50. Another form of transportation is with the bus with the metro. The in-home support services available occur with patients who are 65 and older. They have Medi-Cal, and they end up having a government employee from the state of California come in and help them with laundry, making food, changing them, and taking care of them. The more sick they are, the more hours that they have somebody to help them. Another service is Medi-Cal for low income. Many times these patients may be able to obtain Medi-Cal, which will cover the remaining amount due for Medicare. Another service is home health. Home health services provides providers who can care for the patients. They include physical therapists, wound care specialists, and specialist doctors. The last form of service that these patients can have is pharmacy services. There is an example from AGM Pharmacy and 96 Pharmacy. These pharmacies can get the patient their medication and deliver them to their home for free.